Good morning. Myself Varun Kumar. Today we are going to see about the introduction to rehab. Okay, let's go to the class today. So rehabilitation. So definition of rehabilitation. So initially rehabilitation means we are bringing back the person's disability or dysfunction to their normal day-to-day life. So this is shortly we termed as the rehabilitation. So but according to WHO, rehabilitation is the use of all means aimed at reducing the impact of disabling and handicapping conditions and enabling people with disabilities to achieve optimal social integration. So that means by means of various therapy or various treatment, we are using the impact of disabling and handicapping conditions. That means that in various neurological conditions we are using various treatments and making the people with disabilities to achieve into the social integration. Okay, so again, if we seeing as a simplified term, it's a process that helps a person with physical or mental disability to maximize the independence and quality of life. So that is the persons who is present with the physical or mental disability. For that person or for that patient, we are making the persons into the independence and quality of life. So without any support of external persons, we have to make them as a independence and make their life into a quality of life, to lead a quality of life. So this picture represents that patient having disability and give us fully dependent on wheelchair, and patient attenders and healthcare professional making the patient to integrate with the social or community. So this is we term as a community engagement. Okay, so for that we need inclusion, participation and community engagement. So inclusion means we are including the patient and attenders, and the participation by their team, and making the patient into engage with the community. For that they bring the patient into the common park. So in that park there will be a lot of peoples where, so once the patient interact with the people engaged in that particular community, makes the patients to feel give us an okay, like that. Okay. So aims of rehabilitation. So aims of rehabilitation. So it mainly aims to restore the function to the highest possible level. Okay. So we have to maintain the improve the function of the patient to the highest possible level. That means we are making the result which will be more accurate or more possible results, and making the patient to promote independent living and to reduce the complications and prevent disability progression, to enhance the vocational potential and social participation, and also to improve psychological well-being, support the family and caregivers in coping with the disability. So importance of rehabilitation. So main importance of rehabilitations are restoring the function, personalized approach, pain reduction, time and patience, and also preventing future injuries. So for achieving the rehabilitation, we have to know about this one. So we have to concentrate on restoring the function, personalized approaches. Why personalized approaches means patients will differ from various conditions. So we have to build a personalized approach for each person or each patient. So principles of rehabilitation. So early intervention. So what will be the main principles of rehabilitation means we have to focus on the early intervention, because whenever we start the rehab as soon as possible will bring more results comparatively for chronic conditions. So we have to do a rehab, we have to start a rehab as soon as possible. Okay, holistic approach which includes the physical, psychological, social, occasional and then the spiritual. So teamwork is needed, and also patient-centered care we have to focus. Then there will be a continuum of the care. There should not be any dropout. Then we have to maximization of the residual capacity, use of the assistive technologies or assistive devices like orthosis, prosthesis. Okay. So rehabilitation team. So without a team we can't able to achieve more. So like that, for rehabilitation team there will be a core members who is lead by the physiatrist or rehabilitation physician, and followed by physiotherapist, occupational therapist, nurse, speech therapist, psychologist, social worker, prosthetist and orthosist, and then the occasional counselors. So these members have to be act as a core team members in a rehabilitation setup and should be as a rehabilitation team. Scope of rehabilitation medicine. So rehabilitation medicine have various scopes in medical rehabilitation, then social rehabilitation, and then vocational rehabilitation, and also in the educational rehabilitation. So role of physiotherapist in rehabilitation. So our role is to be evaluate the impairment and functional limitation. After assessing, then we have to set a plan and implement the exercise therapy or any kind of therapeutics. Then we have to prevent the secondary complications, train them with walking aids or orthosis or prosthesis. Then we have to encourage the independence in their daily life activities. Then we have to work with family and caregivers for home programs. So we have a case example or case study for this topic. A 28-year-old male with a T12 spinal cord injury following a RTA. So what do you have to focus on? So early phase we have to prevent the bed sores and we have to give a chest physiotherapy. In later phases we have to focus on the strengthening upper limbs and then the wheelchair training activities. In community base we have to give a vocational guidance for computer based job. Okay, so this is a roadmap. This is a flow chart which involves for the particular patient in the rehabilitation team, they are dependent on physician, physiotherapist, nurse, social worker, occupational therapist, psychologist, ergotherapist, psychiatrist, prosthetist, and then the sports therapist or speech or language therapist. Okay, so this is all about the introduction to the rehabilitation. Okay, thank you.